The following is a Cable 14 special presentation.
Hello everyone, and welcome to this television special. My name is Connie Smith. We are all older, aren't we? Older than we were a few moments ago, older than we were yesterday or yesteryear, and that's a good thing. And wherever we are in our timelines, we all want the journey to be as healthy, safe, long, and joyful as possible. That's why the United Nations declared October 1st the International Day of Older Persons. Last year, on the 30th anniversary, UN Secretary General Antonio Guterres acknowledged the disproportionate and severe impact that the COVID-19 pandemic has wrought on older persons around the world, not only on their health, but also on their rights and well-being. And we've seen that terrible impact in our very own communities. In the city of Hamilton, we have celebrated and showcased the amazing accomplishments of our senior citizens every year as they set the bar for who and what we all can do to make our world, our city, our neighborhoods a better place. But too many seniors are suffering from lack of care, even air conditioning for too many in long-term care facilities, as climate change, according to the World Health Organization, has become the #1 health threat of this century. There are demands to cut privatization of health care and contracting out, to increase the pay of care workers, to establish universal pharmacare. Maintaining quality of life as we become older also has a lot to do with our ability and our will to stay connected. And in this digital age, that's an ongoing learning curve. And as a theme of this year's Day of Older Persons, digital equity for all ages. So what are governments doing? What more should we be doing right now to address the dire issues facing older persons? And how should we plan for the future? Over the next half hour, we're going to put those questions to two experts dedicated to our health and welfare. We'll be right back with Hamilton's Medical Officer of Health, Dr. Elizabeth Richardson. Welcome back to our Cable 14 special on this, the International Day of Older Persons 2021. You have seen, heard, and read a lot about our first guest, Dr. Elizabeth Richardson, the Medical Officer of Health for the City of Hamilton since 1998, working with community partners to ensure that the safety of the food we eat, the water we drink, and the air we breathe. Dr. Richardson is a public health and preventive medicine specialist and an assistant clinical professor in the Department of Health Research Methods, Evidence and Impact at McMaster University, and served on various committees with the Ministry of Health and Long-Term Care, as well as the Royal College of Physicians and Surgeons of Canada. Welcome, Dr. Richardson.
Thank you, Connie.
We all know how strained the public health system has become during this pandemic. Looking at the scenario with respect to seniors right now, give us a snapshot of where we're at in the fall of 2021.
Absolutely. And before I begin, I just want to say what a pleasure it is to be here with you today, Connie, and to say a big thank you to the organizers of this show, and particularly the International Day of Older Persons Organizing Committee. And of course, extend our gratitude to all of the seniors in our community for all that they have done to make Hamilton a very warm and inviting place. We at Hamilton Public Health Services are very grateful for all of our seniors. So back to your question about COVID-19 and seniors, you know, we have really seen the devastating impacts of this pandemic on everybody in our community, but particularly so for seniors. In that first wave in long-term care homes, retirement homes in particular, seniors really suffered, and we saw a large number of cases, we saw a large number of deaths. Fortunately, as we've gone through this pandemic, we've learned more about all the things that are important from an infection prevention and control perspective, all the measures that need to be put in place. They're tough. These long-term care homes, retirement homes, they are working very hard to protect our seniors that are in those settings. And as well in our community, we know too that because seniors have needed to be at home, and often, you know, for they and others in our community, it's led to a lot of isolation. And that's been very difficult. That's been very stressful on people's mental health. And so we're quite aware of that as well. So as things have gotten better, as we've gotten better at infection control mechanisms, as we've got better at public health measures, and of course we had the vaccine come on the scene in December of last year, We've continued to see our vaccination rates go up, and that has been critical in combination with those public health measures to protect everyone, but particularly our seniors. They're still at higher risk. They're still at higher risk even when they're vaccinated, because no vaccine is perfect. What that vaccine does is particularly protect them against severe disease and hospitalization. But our seniors are still the ones that we're all encouraging everybody out there to get vaccinated for, to help protect them, as well as others that can't be vaccinated in our community.
So moving forward, how can seniors best cope and get through this pandemic?
Well, I think there's a number of things to think about. So one is still the vaccination rate. So we're very pleased that seniors have taken the lead, and 87% of our seniors are vaccinated with 2 doses here in Hamilton. So to continue on forward and get vaccinated if you haven't yet. If there's a concern, talk to your family doctor, talk to your nurse practitioner, or call our COVID vaccine hotline. That's the 905-978-9848 number. And they can talk to us about any concerns around vaccination. The other is to continue to wear those masks, take those public health measures, and then, most importantly, once you've taken those measures, get involved in our community. And so staying connected continues to be so very important for everybody, and especially our seniors. So our rec centers, for example, they are offering programming that is targeted to seniors, and as well in our senior centers. And we have virtual options that are available. Connecting virtually, while it's not necessarily as good as it is to connect together face to face, it is another great option. And of course, we have options that we can do over the phone as well. So connecting into those things is very important for seniors and for all of us to continue to do.
I want to get into the whole digital connection too in a moment, but first, what's the status of the 3rd vaccination shot that we've heard a lot about lately?
Right, so that 3rd dose is a big question for everybody, and everybody's asking, do we need to have, we're going to have ongoing booster doses. And these kinds of decisions, of course, aren't decisions that are made here in Hamilton. These are questions that are getting asked across the country and around the world. And we're fortunate to have the National Advisory Committee on Immunization, who works with the Public Health Agency of Canada. And these are experts from across the country that look at all the research evidence, the scientific data, and they make recommendations about 3rd doses. Then our own local provincial experts, our Chief Medical Officer of Health for the province and others, again, look at this data and decide how to use it here in Ontario. So right now, the recommendations for 3rd doses really are focused on people who are immunocompromised. And so people who have are on chemotherapy, for example, for cancer, or who for some other reason are immunosuppressed, are recommended to get 3rd doses. And so those are recommended to happen 8 weeks after their 2nd dose. And primary care doctors, specialists, the specialty programs are reaching out to the people who are in those programs, transplant programs, cancer programs, to notify their patients and make sure they're aware that they're eligible for and should get that 3rd dose. We're also doing 3rd doses for people who are living in those long-term care homes and those high-risk retirement homes. And so that's happening actually at the 5-month mark, and is actually about concerns about whether there's any waning in immunity. And so we're working with long-term care homes and our high-risk retirement homes. We're getting them on board. There's a computer system they have to use, talking about the digital issues. And then they're setting the schedule to get those vaccines done. But the target date for those 3rd doses in those long-term care homes and high-risk retirement homes is October the 8th. So we're really trying to move that one forward.
And looking at the passport system, are you concerned, and how concerned are you about the impact that, again, this kind of digital technology, which is great, but are you concerned about how that could impact seniors negatively, who aren't maybe tech savvy or don't have access to technology?
Yeah, the proof of vaccination system, I think the first thing to think about is really, where do you need it? And so it's really important to remember that what this proof of vaccination system is doing is really required in non-essential places. So it's not required in grocery stores. It's not required to go and see your family doctor. It's not required to go and get medical supplies or go to the pharmacy. And so you can go out and not worry about it in those settings. It is required, though, in places like eating in restaurants, in bingo halls, in bars and nightclubs, in banquet halls, all those sorts of facilities. And the reason why it's important there is that's where we either take our masks off to eat and drink, or we're having some sort of physical exertion. So we may be dancing, for example, at a reception, or working out in a gym. And we've seen that those are higher risk settings. And so we do see outbreaks in those settings, and so that's where it's targeted. So there are a whole range of ways to get your proof of vaccination. You can have it electronically, and you can get it on your smartphone or on your tablet or on your computer, or you can have a printed copy. So it can be a little bit complex in terms of how to get it, and there are different ways. So there are a number of things you can do. So the first thing is you can go online to the provincial portal, and you can pull it up, and you'll see there's an option to pull up your receipt and get that digital copy, and you can print it off if you're a tech-savvy person. If you're needing some help, you can call the provincial hotline in terms of them helping you. So if you have a green health card or a red and white health card still, you call that provincial hotline number, and that's 833-943-3900, and they will help you in terms of sending you that copy if you can't do it yourself. Now, some people don't have a health card at all, and then they can call through to us at that 978-9848 number, and we will help them to get their vaccine receipt to them. There are also, of course, people who are homeless, and that even includes homeless people that are seniors. Mm-hmm. And in that case as well, they can call through to the provincial line, they can call us, we can connect them with that provincial system, and they can actually get that receipt delivered to somebody who's a trusted friend, a trusted agency, somebody like that who can help them around that receipt. The other great thing, and we have been dependent on partners, of course, working together, pulling together as a community throughout these, is all of our Hamilton Public Library locations are available. All 23 spots have been set up. They'll offer their printers, their computers, their laminators to get that proof of vaccine printed. They've actually now installed direct phone lines to us back at Hamilton Public Health. So you can go there, work through the issues. They can call through to us and put you online with us, and we can sort it out together to make sure everybody has a copy. So we know that digital divide can be there, and we want to make sure that everybody can get that proof.
What has to happen, even beyond your control with public health, in the next months, in the next year, to put us to where you'd like to be, perhaps this time next year, for instance?
So, I mean, the primary thing is this vaccination campaign, right, and continuing to move forward with this. Currently, we're sitting at about 82%. Hopefully, that number will continue to go up. About 4 out of 5 people are vaccinated. 3 out of 4 have 2 doses of the vaccine. We want that number to get up over 90%. And so that's for both doses, and that's all across the city. We do know some parts of our city, unfortunately, don't have access to the vaccine, have not been able to get vaccinated. And so we're working hard to make sure that they are able to get it everywhere. And there are spots in every part of our community. There are mobile clinics. You can get clinics, go through our 2 primary care-led clinics. That's at David Braley Health Science Centre and Winterberry Family Practice. You can also drop into and connect with your pharmacies. There's over 100 pharmacies. So vaccination is absolutely key. Continuing to use those public health measures, of course, is also key. So wearing our masks, continuing to do the physical distancing as we're doing now, continuing to do the work where you are minimizing your contacts at present while we get through, see what this 4th wave is. And then ultimately, we'll continue to look at how we move forward. The bottom line is we do have to figure out how to live with COVID-19. And I want to underscore live. And this gets us back to the piece about participating with our community, engaging with other people, and doing that as safely as we can. So we're going to have to continue to balance things as we move forward.
But some hope is in your voice. Very quickly, am I right?
Well, absolutely. I think we've learned to live with many viruses. We've learned to live with the influenza virus. We've learned to live with all sorts of things and figured out how to balance the risks. And it's important to remember that the control measures have risks too. We know they have mental health impacts, social impacts, emotional impacts. And so I'm very hopeful that as a community, we are going to get to a place where we're figuring out how we can move forward.
Thank you, Dr. Elizabeth Richardson. We'll be right back with the Executive Director of the Social Planning and Research Council for Hamilton. We are back on this International Day of Older Persons 2021, a second year battling a pandemic as we focus on this year's theme, Digital Equity for All Ages. With me now is Kim Martin, Executive Director of the Social Planning and Research Council of Hamilton, which tracks trends, conducts and analyzes research, and identifies needs which guide policy when it comes to what it's like to live in this city. Kim has held several leadership positions in the nonprofit behavioral health sector in Ontario and internationally. Her areas of expertise include business development, healthcare marketing, which obviously speaks to this year's theme of access, specifically when it comes to seniors. Kim Martin, welcome to our television special. We've talked about the physical health of seniors during this pandemic, but I want to talk to you about their social health, their mental health, and what your concerns are with that respect at this point on this International Day of Older Persons.
Thanks, Connie, and thank you for having me. I think just in terms of everything that we've all seen in terms of COVID, there are a number of concerns, obviously, for older population living in Hamilton and elsewhere. We've, through our partnerships and collaborations, noticed certainly social isolation comes up, I think, as one of the key issues for seniors right now, and has been over the more than a year that we've been dealing with this. A number of our partners have shifted their processes to be able to offer services in different ways during the pandemic, which has been very creative. But certainly, as we're still in the midst of a pandemic right now, that still is a concern.
And their access and seniors' access to whatever services are out there to help them.
Yeah, and that's been reduced in some areas too. I mean, there certainly are some barriers for seniors to access services. So many services have gone to digital formats, and that's not always easy for some seniors to access, just in terms of their own technical savvy as well as just proximity to the equipment to be able to do those things. So there definitely have been some barriers that have come up as a result.
Kim, what about the whole issue of scams that are targeting seniors? Are they on the increase now?
They are on the increase. Mm-hmm. They are on the increase. And part of the problem with that, Connie, is that people are more isolated. Mm-hmm. And so they might not have those same touch points with their family to see them in person, or at least, while COVID has been going on. And so they can fall prey to them. And one of the things, we had noticed this actually prior to COVID in terms of the increase of scams. But one of the things that we did was we received some funding through a Horizons grant, and we actually developed a workbook and a work program and a program for seniors to help them with that. And so we had initially intended that this would have been an in-person activity through apartment buildings and community centers. What we did during COVID was we shifted that, and so that we offer those services now over the phone. And so that we're actually having phone workshops with seniors in their home, giving them information. They get mailed a booklet of common scams and things to be aware of, and they have something to put right on their fridge to remind them as a magnet in terms of things not to do when people are calling.
So what kinds of trends have you seen through your research that pertain to what's happening with our seniors right now?
Well, some of the research that we've done has been through and for the age-friendly Hamilton. Mm-hmm. And we did some research for them in early 2020 and into a little bit of 2021 that really looked at what was happening in terms of our census data. So what were we tracking? How are we trending with seniors in Hamilton and even provincially? And it really was incredible to see that we've got a large population of seniors in Hamilton. About 30% of our population are seniors, people over the age of 55. And as they age, of course, there's going to be different needs. And we're seeing that there's certainly more diversity in our senior population. Just looking at 2016 data as compared to 2006 data, we're really anxious to see the 2020 census data as it's released and becomes more available, because these sort of things are going to be tracking upwards. So we're seeing more seniors that are Black, racialized, Indigenous seniors in Hamilton. We're seeing seniors that have more seniors that have English that is not their first language, and different languages, and so there's a real there's a real diversity in our senior population. And even when you think about how we define seniors, we define them really, generally as 55 and older. So that can be 55 up to 105.
That's a long span, Kim.
That's a big, that's a big group, and there's just a lot of diversity. The needs of what someone needs at 50 or 60, 55 or 60 are very different to what they need at 80 or 85.
So what needs to happen from what you've determined in your research and trends to make it more accessible for a more diverse in language, in culture, to make aging a more joyful, healthy, safe journey?
Well, I mean, there are a number of things. I mean, some of the areas that we tend to focus on in terms of the Planning Council are, we've looked at, how do we address poverty with seniors? What are some initiatives that can help in terms of financial security? Because with financial security also will tap into health, health wellness and social wellness and other aspects. So we've done that through one of our programs, the Financial Empowerment Program, that works with a lot of seniors, and that program helps them file their taxes.
You must have some partnerships that help seniors with the whole access aspect of information and technology, specifically this digital theme that we're talking about for this International Year of Older Persons.
Yeah, we've worked with a number of community organizations that are doing more on that end. Absolutely, absolutely.
Talk to me too about the United Way, because I think it's wonderful that you're not just in offices doing research and analyzing policy. You are partnering with frontline workers to transfer what you've learned to actually helping people in the here and now. And I think that's a very vital connection and wonderful aspect to what you do.
The United Way has been a strong supporter of the community in general, and in particular, of the nonprofit sector. And they support over 266 agencies in the community. So that alone is pretty incredible for Hamilton. SPRC has been really fortunate to be a longtime partner with the United Way, and when our funding ended for our financial empowerment project, which ended in April, in terms of we had a Trillium grant that allowed us to do that program for 3 years. Both the United Way and the Hamilton Community Foundation stepped up and identified that this really was an important service to the community, and it was filling a gap. And so to be able to have free tax filing year-round for low-income families and individuals was significant. And through that program, we brought in over $11 million in that time period.
That's significant.
Yes, and even just in the 2020 tax period, we have brought in, I think, $2.2 million for seniors. And that's in benefits and credits that they might otherwise not have been able to access.
So looking ahead, getting through and hopefully emerging from this pandemic for seniors, what needs to happen? What would you like to see happen with outside of your bounds, provincially, federally, whatever? What would you like to see happen to make what you want to do, what you have to do, happen?
I think we really have to look at the intersectionality of the senior population, and look at the individual needs of particular groups within this group that we call seniors. So, and I think we need to really look at the lived experience and get advice from people with lived experience, people with disabilities, people who are racialized, people who are living in low incomes, to ask them, what is it that they need. We've identified some needs, particularly in terms of like our financial empowerment program, and we've done advocacy at the federal level in terms of tax filing services that we think are needed, and we've advocated for, benefits to continue, for example. I think one of the things that people might not realize is that if people don't file their taxes, they don't have access to the benefits and the credits that the government has available. And so if for some reason they're not able to do that themselves and they have a year go by or 2 years go by, that means that they get discontinued from those benefits. So certainly a system that would really look at the whole situation, and even automatic tax filing would be something that would be beneficial for people that are living on a low income where there isn't a lot of fluctuation and change, just to make things easier and to reduce those barriers.
What would your message be to seniors watching this right now, or friends or relatives of seniors, to really help them make the most of getting through this troubling time that the world is facing?
At this point, I would really encourage people to reach out for supports. I think that one of the things that's been incredible about the community in this period of time is the amount of help that has even increased in our community, and how organizations, many nonprofits, and with help from our private sector, are really trying to meet the needs. So where people are needing help, to reach out for that help. And I mean, one of the services that we provide through our financial empowerment program is to also help link people to services if they are disconnected. So I think that Hamilton has a strong network of community organizations that work well together, and that's one of the things I would like seniors to know about.
Who should they reach out to? Can they reach out to the Social Planning and Research Council specifically, or would you just suggest some kind of a directory where they could find a specific service?
They can certainly, I think there are some services that are available online. I know that when we get calls, we make referrals. Our financial empowerment program, for example, I can give you that number for people that are interested in filing for their taxes, or maybe they haven't done it yet. And that's 365-366-1767.
And finally, where do you hope we'll be a year from now during the next International Day of Older Persons?
A year from now, I hope we're going to be in person. I hope that we're going to be able to gather. I think that there are, a lot of services that are better received when they're in person, and particularly maybe for seniors as well. So I hope that we will be having more gatherings and being able to come together and really end some of that isolation that we've experienced.
I hope so too, Kim Martin. Thank you so much. Kim Martin, the Executive Director of the Social Planning and Research Council of Hamilton. Thanks also to Medical Officer of Health, Dr. Elizabeth Richardson, for joining us today, all the sponsors who make this program possible, and to you for joining us on International Day of Older Persons 2021. Visit cable14.com to watch this program again. I'm Connie Smith, reminding you to get vaccinated and be kind to one another as we all look forward to a happy, healthy, and safe future.